Mr. Chairman, I don't believe that this legislation we're considering should come as a surprise to anyone. This House has been in session now for almost 24 hours, and no Republican has yet taken action until this committee began to attack the Affordable Health Care Act. And you just don't waste a day like that without an attack on the Affordable Health Care Act or an assault on women's health care or an attack on efforts to clean up our air that we breathe and the water that we drink. And so this is a natural process. And it is, of course, this particular legislation relates to a broader guiding principle of Republicans here than just affordable health care. It's the same principle that applies to public transportation and the highway bill. It is the same principle that applies to our national security. Until recently, when so many of them essentially gave up on public education, it was the same principle that applied to public education. They're for it. They want to see the new bridges. They want to see additional weapon systems. They want to see improvements in the quality of public education. They just don't believe in paying for it. And that's why we limp along from transportation bill extension to transportation bill extension, because we cannot get any kind of bipartisan agreement on how to finance these vital public programs. And the same is true of health care. And so today we have not one but four bills, $42 billion in cuts in revenue, because they say they're for health care. They just don't believe in paying for the health care. I don't know about some of these provisions. I expect some of them would not have been my first choice for how to finance affordable health care, but it needed to be financed. There is no free lunch unless we continue borrowing from the Chinese and the Saudis. The House rules may not dictate and mandate that we have an offset for these various tax provisions that are being cut and revenues that are being reduced, but good judgment certainly does demand that. To suggest after they have cried all year long and before that our deficits are out of control and that we need to bring our budget into balance and that their solution is to add $42 billion in additional deficit and additional borrowing unless it is offset if it became law, is the height of irresponsibility. Now let's look specifically at health care and the much feared Obamacare, of which the worst feature is the Obama part, apparently. We got into the Affordable Health Care law as a reform because there is a health care crisis in this country, and it continues. Too many of our small businesses and our individuals are paying far too much for their health care and getting not enough of it. Just to give you one example of how the Affordable Health Care Act has affected Texas. Under Medicare, one of those much condemned government health care programs, the administrative costs run about 2%. In other words, about 2 cents out of every dollar going to the much feared government bureaucracy that efficiently administers the Medicare program. Under the Affordable Health Care Act, we put in a requirement that insurance companies that provide individual health care policies, they are limited not to 2 cents but to 20 cents. A very generous, indeed overly generous provision to those companies. I think it should have been a much higher requirement. But even at 20 cents of administration compared to 2 cents for Medicare, Texans recently received an announcement that our small businesses and individuals would receive $186 million in rebates because of overcharges, excess above the 80 cents in Texas alone. And that's true with many other places around the country. And of course, there are those many families who are just one accident on the way home tonight, one disease afflicting a child from finding themselves in bankruptcy, as millions of American families have found themselves because of the gaps in our health care policy. We know that we pay too much for health care in the United States relative to other countries, and we come out behind on so many leading health care indices. We pay too much and do not get the care that we need. And so we came forward with the Affordable Health Care Act, not the approach I would have taken. I wish we had a much more comprehensive and stronger health care act. No, President Obama turned to a middle ground. He took the idea that that Governor Romney is no longer so proud of, and accepted it as the middle ground, and these Republicans don't have an alternative that they have advanced, and they've now had 17 months to do it. All they offer
Regular order,
is
Mr.
today's
Chairman.
proposal to
Time has
cut more.
expired.